Learning about bone disease is incredibly important because osteoporosis is a disease that affects all of us. It causes incredible morbidity. Think of all those broken hips. In this lecture, we're going to discuss key ideas about 4 important benign bone diseases: osteoporosis, osteonecrosis, osteomyelitis, and Pagets disease of bone. Osteoporosis occurs because of loss of bone mass. Literally, the calcium leaks out of the bones and they become thin and fragile. The diagram to the right here shows that peak bone mass occurs around the age of 30, and after that in men it declines steadily. In women there's a sudden drop-off around menopause, which then further declines with age. So while women always have less bone mass than men, postmenopausal women are particularly vulnerable to having fragile bones. With age, there is decreased osteoblast proliferation and decreased synthesis of bone matrix. In addition, decreased physical activity, particularly the bone loading, decreases as we age, which accelerates this loss. In addition, decreased estrogen levels post-menopause decreases cytokine secretion, which stimulates the osteoclast activity. In summary, pathogenesis is due to decreased building and increased loss of bone. The entire skeleton is affected by osteoporosis, but in particular, postmenopausal osteoporosis affects bones with an increased surface area, like vertebral bones. In the picture to the right here, you can see a spine where the vertebrae have collapsed. So the vertebrae are the dark bits, and the discs in between them are the light bits. And in particular, the central vertebrae has collapsed down. This is because the bone in there has become so fragile that even normal activities will cause microfractures. It particularly happens here at the top of the spine, giving rise to the classic widow's hump. You've seen it all in old people. To avoid widow's hump, bone fractures in the hips, and other complications that dog the lives of elderly women, we want to learn how to prevent osteoporosis. In the pictures to the right here, we compare a thin osteoporotic trabeculum in a bone to a normal one at the bottom. It shows how the trabeculae thin with age. They're also reduced in number and lose those micro-connections, the matrix that makes bones strong. All these lead to the microfractures and that collapse that compresses vertebrae. Moving on now to think about osteonecrosis. This is a relatively common disease. It primarily affects the hip. It's due to a traumatic fracture which interrupts the vascular supply to the hip, just under the articular surface. Corticosteroids also affect the blood supply to bone. The first administration of corticosteroids often goes okay, but it can be a complication of second or prolonged corticosteroid administration. In the hip, osteonecrosis typically affects the superior articular surface between about 10 o'clock and 2 o'clock. It can be traumatic, in particular neck or femur fractures, or non-traumatic. In the traumatic fractures, only the hip that is affected will undergo osteonecrosis, but in non-traumatic cases, such as post-corticosteroids, it's bilateral in 40%. These pictures show the physical and the X-ray appearances of osteonecrosis. You can see the area of osteonecrosis as the pale area underneath the cartilaginous cap, which is slightly separated. Underneath that is an area of bone density seen in the X-ray. This is where the body is trying to heal the area of osteonecrosis. And then further down towards the shaft, we have an area of normal bone. Osteomyelitis is infection of the bone. Most commonly, it's a primary focus of the disease, but it may be part of a systemic infection. It affects primarily the long bones and the vertebrae of healthy parents, and on X-ray appears as a lytic lesion surrounded by a zone of sclerosis. Infection can get into bone either by hematogenous spread from a septicemia or extension from a contiguous site. Sometimes it can happen through direct implantation. The organism that causes osteomyelitis is Staph aureus in about 90% of cases. Inside a bone, the area that can swell is limited. So when an infection localizes in the bone and the bacteria proliferate, causing an inflammatory response, it expands and it squashes the blood supply. Both these lead to cell death and necrosis. So it's the swelling of the tissues that leads the inside of the bone to become ischemic and die. As the bone undergoes necrosis, the infection then spreads along the bone shaft. The inflammation can expand and go through the cortex, disrupting the periosteum, which further impairs blood supply, but also means that a sinus can form and the abscess infection can leak through to the surface of the skin. This diagram shows the sequence. So first there is an infection that occurs in bone, and then it expands, compromising the blood supply. Pus collects in a subperiosteal location. After that, the pus can break out, forming a sinus. There are two other things that are often talked about in the pathology of osteomyelitis. The first is a sequestrum. You can see a sequestrum in the lower diagram. It's that pale area in the pus. This is essentially a lump of dead bone which is sitting there surrounded by pus. And then there's the involucrum. So the involucrum is an area of bone that is attempting to heal around the area of abscess. Pagets disease of bone is common in Caucasian populations, affecting eventually up to 5 to 11%. We don't know what causes Pagets disease. There's been all kinds of things proposed, but one that's a favourite is a paramyxovirus causes the infection, perhaps by a kind of long-term reactivation. Pagets disease undergoes 3 phases: an osteolytic phase, where bone is lost, and then an osteoblastic phase, where lots of bone is produced, but in a really disordered fashion. In this phase, there's lots of new blood vessels formed in the bone, and the bone thickens and expands. And then the final phase is the osteosclerotic phase, where all this new tissue is formed into hard bone. Now you may think this hard bone is going to be really difficult to fracture, but actually it's not. It's really prone to fracture. The reason is that the bone is very disorganized. It doesn't have that beautifully strong matrix that normal bone has. And so people with Pagets disease can present with bone fractures. In addition, all this bone replication means that people with Pagets disease are at increased risk of osteosarcoma. We're going to discuss this in another lecture. So in summary, we've learned a lot about some important diseases of bones. In particular, we have to remember all the details about osteoporosis. It's really common, and new treatments are coming out that help women retain and rebuild bone. In your lifetime, and hopefully mine, osteoporosis will be a disease of the past.